When they call your name in the lobby, your palms get sweaty, your heart rate rises, and your hands start shaking. Just the thought of a needle puts you over the edge and makes you nervous. This is a normal reaction that almost everyone experiences when their doctor mentions blood work. Walking into a lab or a donation bus can be a very scary thing, whether it's your first time or your 500th time. Good communication between patient and phlebotomist is important and will make your experience having lab work or donating blood run much smoother. Let's start by defining what a phlebotomist is. A phlebotomist is a person trained to draw blood from a patient for clinical or medical testing, transfusions, donations, or research. The duties of a phlebotomist may include properly identifying the patient, interpreting the tests requested on an order, drawing blood in the correct tubes with proper additives, accurately explaining the procedure to the patient, preparing patients accordingly, practicing required forms of disinfection, practicing standard and universal precautions, performing venipuncture, withdrawing blood into containers or tubes, making sure that the puncture site stops bleeding, instructing patients on post-venipuncture care, ordering tests per the doctor's orders, labeling the tubes with the correct patient identifiers, and making sure the specimens go to the correct lab. So, as you can see, a phlebotomist's job goes well beyond just being a vampire, as some like to call them. This is where good communication comes into play. According to Helen Ogden-Grable and Gary Gill in their essay titled Preventing Phlebotomy Errors, Potential for Harming Your Patients, they state, there will always be a chance for error when a phlebotomist fails to communicate properly with his or her patient. Communication begins the moment the patient walks into the lab. First, a phlebotomist should introduce or identify themselves to the patient by stating his name and/or his title. He then should communicate to the patient that he is there to draw blood per the orders from their doctor. By doing this, he is informing the patient and obtaining permission from the patient to move forward with his process. Every patient has the right to refuse any procedure, as stated in the AHA Patient Bill of Rights. Also stated by Helen Ogden-Grable and Gary Gill, if a phlebotomist does not look at or listen to their patient and ignores their verbal or nonverbal refusal, he is guilty of assault. A good way to avoid the patient feeling threatened is to demonstrate good communication from the beginning. The following statement was taken from a website called Media Lab, which is used for compliance and continued education courses for phlebotomists. It states, it is important to prepare the patient adequately for the blood collection procedure, not just physically, but also mentally. We have already discussed how to physically prepare the patient for blood collection, but to be respectful and educate the patient, the phlebotomist should allow time before the beginning of the blood draw for the patient to ask any questions they may have. As we discussed earlier, the phlebotomist should allow time to share or explain the sample collection process and to describe post-venipuncture self-care information. The phlebotomist should use simple vocabulary and not complex medical terms when explaining procedures or answering patient questions. The venipuncture procedure is very complex and requires both knowledge and skill to perform. Each phlebotomist generally establishes a routine that is comfortable for her or him. Here comes that communication again. Some patients may be nervous or scared since there are needles involved, or some people just don't like blood. So a phlebotomist has to know how to talk to a person to calm them down or to ease their nerves. As described in our Understanding Human Communication books on page 135, listening is a good communication tool to use with patients. A phlebotomist should listen to their patient's concerns about the phlebotomy procedure and be able to offer empathy and make them feel comfortable with the procedure about to be performed. When a patient feels comfortable with their phlebotomist, they are more likely to consent and let the phlebotomist do their job the way it is needed to be done. After an interview with Amber Robertson, a phlebotomist at the Northcrest Medical Center lab, I learned that every phlebotomist has their own way of communicating. Amber stated that a smile goes a long way with my patients. If you greet them with a smile and make the process as easy and pain-free as possible, most people will leave happy. As you can see, communication goes a long way in the phlebotomy procedure. From nonverbal communication, such as a smile or body language, to verbal communication of explaining things and listening to the patient. So next time you go have your blood drawn, communicate with your phlebotomist and see how much easier your experience is.